Hello friends, I am Dr. Yukti Wadhawan from LaOrigin IVF Gynecology, Delhi. Today I am going to tell you about menopause. Menopause, we all know, means when the periods in a woman stop. That is, cessation of menstruation. In Indian setup, it happens around 50 years of age. In some women, it can be premature, around 45 years of age. Now what happens in menopause? There is a decrease in estrogen hormone. Now this decrease in estrogen hormone causes a lot of symptoms, commonly known as osteoporosis. That means there is a bone loss that happens. So a common complaint in menopausal women is backache, lower backache, right? And they're also prone for fractures. Another symptom is vasomotor symptoms. That means there is a disturbed sleep, there are night sweats, they feel very agitated, very irritable, they have hot flushes, mood changes. So all these are postmenopausal symptoms. So now what should these women do? With the routine investigations, you also need to check your serum calcium, serum vitamin D level, parathyroid hormone and X-ray of your lower spine and the upper hip area. Also, you need a DEXA scan. Now what is a DEXA scan? DEXA scan is used to measure the bone mineral density. That is, how porous are your bones, right? And commonly to interpret, we have a T-scoring in DEXA scan. That when you visit your doctor, they'll tell you about. Now what is the lifestyle recommended for menopausal women? They definitely should add calcium in their diet. The daily requirement is around 800 mg per day. Then you should have adequate vitamin D exposure. The only source of vitamin D we have is the sunlight. So if you go out in the sun for about 30 minutes in the first half of the day without wearing any sunscreen, and if your 20% of the body surface area is exposed to sunlight, your vitamin D content is good. If not, then please supplement vitamin D in your diet and with the medicines. Another thing that you need to do is limit your alcohol. So in women who take excess of alcohol, so in them also the bone mineral density decreases very fast. Tobacco smoking is a strict no. Caffeine intake, nothing in excess. Only in moderation is fine. Along with all of this, I would recommend some exercise with weight training, resistance training exercises, a little bit of weight bearing. So what should these postmenopausal do? Postmenopausal women have a variety of medication available, but on certain criteria we can decide what is suitable for you. So firstly, if you've had fragility fractures in 40s, if you have a family history of osteoporosis, if there is a radiological evidence which shows osteopenia, that is, your bone loss is depleting, it is becoming less. Then women who have any associated factors like cardiac risk or risk of stroke, or your lipid profile is deranged, or your calcium level is very, very low, that is your hypocalcemic, or women who have a risk of breast cancer or endometrial cancer. So all these factors have to be taken care of when prescribing you any medicine. So if you people are undergoing any of these changes, so please seek help. Visit your gynecologist and then they'll probably give you the best medicine available and you'll have a better quality of life. Thank you.